I'm Sister Riëtte Grové, working for RX Health, doing the disease management as well as the provider relations for RX Health, and I've been here since 2011.
What is your role when attending and or contacting members presenting with COVID-19 symptoms or who have tested positive?
Okay, currently I'm managing the telehealth system, which where a patient complete the assessment form will come through in a workflow to me via SMS. Once that I receive the SMS, we'll contact the member, do a follow assessment with the patient. We'll look at the patient's current symptoms, what is the severity thereof, any chronic conditions, medication that the patient is currently being used, whether they've tested positive, look at the any specific complaints that they might have. From that assessment, I will refer it back through to the medical advisor, which will then provide a script to the member, where the patient will then arrange. I'll support also some of the patients then to get access to the treatment, to go and collect, arrange with a pharmacy or family member. Once the medication has been received, I will follow up with the patient to understand the treatment that we were provided to them. How does the injection, the medication work, and then from there on also support the patients by adding them on my cell phone, which I then monitor these patients with their symptoms, so we can get a baseline, identify the severity thereof, and then obviously do a lot of health education. That is extremely important in the management of the whole COVID. From symptoms, lifestyle, as well as the mental health. The patients are getting very easily experience anxiety of what happens to them. So to provide that comfort, there is a nurse on the other side of the line, which is just a phone call away, is the service that I do provide.
Is there any case that stands out for you personally?
I've dealt with a lot of special patients during this time. Specifically, there was a member in Rondebosch area who contacted via the WhatsApp team that she had a challenge to claim medication. So the call was, or the patient detail was forwarded through to me. And when I found this member, she was so out of breath, had difficulty to speak, just constant coughing. And I knew that this lady is really in trouble. I had no means of getting any details sort of out of her. She didn't have a sat meter or able to give me a pulse rating. I've actually insisted that she needs to go to hospital because I knew that she was in trouble, and she just refused. She started crying that she cannot be sent to a hospital. She's a mother of 2 children. She needs to live. She needs to survive this. So while I had her on the phone, I contacted the doctor and asked if he will please help me with a prescription, because she is really so out of breath. I actually had difficulty to have a conversation with her. So we assisted her with a prescription, also for nebulizing her medication. And at that time I've asked her, she must just try and stay calm and give me her husband's contact details so that I can arrange for her medication to be ready for her to go to a pharmacy. So I phoned the member back and I started with breathing exercises for her. At that time also, due to her very severe anxiety, I actually prayed with this member to get her to be calm and stay through. And so actually that whole night I was with her on the phone all the time, sending her messages, update me on how she's doing, and she really started getting calm. So the next morning I woke up with a nice WhatsApp message that she created for me and the doctor, just to say that we are lifesavers and how we supported her through the night. So that was quite special for a mother to take her through that process. So yeah, it was something very close to my heart.
Has there been examples of members that were impacted in areas outside of the big cities?
Yes, I remember specifically a case where on a Monday morning I was following up on the electronic results we received from the labs. And then there's one patient, which was an elderly woman in the age of her 50s, which I followed up, phoned the member, and on the phone line came the patient picked up the phone and could hardly speak. She was so out of breath, constantly coughing, that she really couldn't get out a word of her. So I've asked her, she just needs to stay calm, stay focused. I'm phoning for medical aid, and I'm here to assist her. When I opened up the medical aid profile, because I wanted to determine where does this member stay, I knew that we had trouble, and I needed to get this patient with ER as soon as possible. The patient, I realized that this patient's husband was also admitted in hospital, actually ventilated in the ICU. So I tried to ask her just to forward me any contact details of a family member or a neighbor that can assist me with directions to get close to her. I've asked her that she needs to try and to get in a position so that she can try and breathe easier. And I'm there, I'm going to support her, I'm not going to leave her. So at that time I also saw the doctor's details, because that's on the lab form, which I phoned the rooms if they can provide me any, perhaps an address where I can get hold of the member, because I need to dispatch an ambulance to her. The doctor then indicated that there is no ambulances available in the town, as they were standing in front of the hospital trying to get patients into ER, which there was really a huge outbreak of positive patients in the area. This was quite a challenging case for me, because where do I go to? I just felt like I need to get this member. So at that time I saw she did forward me contact details of her neighbour, which I then phoned, and the patient told me, or the neighbour told me, that she's actually on her way to this patient and she will go and pick her up. So she has put up double mask on her face, plastic bags over her hand, got this lady into the bucket. She drove with her to the doctor's rooms, which that was the easiest way we can get her to the oxygen. So I was so relieved when I got the message that this patient was finally safe in hospital. And I followed up with the neighbour as well, and just to thank her for what she did beyond taking care of somebody and risk her own health, and that she needs to follow up with me as well, so we can manage her. So this patient, the wife recovered, she's doing very well, and the husband was in ICU ventilated, and he was discharged on Friday. So during this whole time I really followed up with the patient, and I got the most precious little message on Friday as well, where he phoned in and tried to thank me for all the support we provided. And also just a good end to the story is that the neighbour's husband is also working on one of the mines, and then they decided to join Mvuza after what they've experienced, the support we provided to the members. So that was quite a very special ending to the story for me as well.
With the third wave, we see more and more that all the members of a family are contracting COVID. How has this changed and or impacted the support that you provide?
It's definitely from a psychosocial support to the member, because you've got the whole family structure that is impacted, especially the mother as a caregiver in her family, and to have her sort of not able to support the family, it needs the guidance as far as possible. And then assist also with where we can, if we need to arrange for medication to be collected, is there somebody that can deliver food for them, is the support we try to provide. Also with those members, I will add them to my WhatsApp group, and I do telephonic follow-up with those patients as well. We need to think of, especially the children, are extremely fearful in this time, seeing that the mother or father is being sick and parents need to speak and communicate with the children also on how they are doing, how they are progressing, because this is quite very stressful time for a family.
COVID-19 has almost been your sole focus over the last 16 months, supporting members. What is the one thing that has really stood out for you in this time?
The patients are experiencing extremely fear, and to deal with this uncertainty and assisting patients was extremely valuable for me. If we look at the word managed healthcare, for the first time that definition makes sense to me, and how we have to approach our members from a holistic point of view. It's not just about the medication, it's really to support from the beginning up to the end, even post-discharge, is really to help a patient getting through this whole process. And even from a mental health is to provide support to members.